Highest causes of avoidable death among under 40s worldwide. Professor John McElwain, who is the Chief of Orthopaedic Trauma Surgery at Tallaght Hospital, is here to tell us why Ireland needs to establish its own national trauma centre. We're also joined by Orla Brennan. Orla was involved in a road traffic accident in February of this year and suffered severe trauma injuries to her pelvis. She received medical attention in Tallaght Hospital and is now on the road to recovery. Good morning to you both. You're both very welcome. Thank you very much. Orla, you were saying to me that your treatment and the progress of your treatment has been really, really good, and you're delighted that it's worked out like that. But that if you had been in a different part of the country, the story could have been different. Why and how? Absolutely.
I think it was just when I actually was brought into Tallaght and actually had seen the plaques that are, you know, on the walls, that it's actually a centre of excellence for the fractures that I had and the pelvic injuries that I had. So I think being in a close proximity to that area and being able to get a bed in that area was very, very
How badly
important.
Injured were you?
Very severely injured. My spine was detached from my pelvis. I had, you know, a lot of fractures. You know, I was told it was basically quite smashed up inside there. So I was very seriously injured and went through a severe trauma at the time of the accident.
You could have ended up in a wheelchair.
I could have ended up in a wheelchair. I could have,
for the rest of your life.
Absolutely, without a doubt. There could have been brain injuries. There could have been anything, you know. So
was your spinal cord affected as well?
Yeah, well, it was detached from my pelvis, and my pelvis was also very, very badly damaged as well. So that was why I was brought into Tallaght.
This is only 15 weeks ago, by the way.
That's only 15 weeks ago, 100 days to yesterday.
Now, you don't look like there's anything wrong with you right now, but I saw you coming into the studio, and you are you're on crutches and you're moving very slowly. But I mean, even that is a miracle by comparison.
I kind of feel like wearing a T-shirt with my X-rays on it, so people understand. You know, underneath there's a lot going on. But yeah, it's pretty amazing result.
And you are ahead of schedule as well.
I'm very much ahead of schedule. Anytime anybody was speaking to me about months to recover, I said, no, sorry, that's weeks or days. So talk to me in that kind of language.
Yeah, so the excellence of the treatment obviously is primary in this instance, but also the nature of the person who's being treated has an awful lot to do with it.
Yeah, it's a get up and go.
Okay, Professor John McElwain. Good morning, sir. It's a pleasure to meet you.
Thank you very much.
I've followed some of your public pronouncements, and what is extraordinary to me, and I said this to you before I came on, and I teed you up with the question, given the catastrophic nature of the serious trauma injuries, you would have thought that in any hospital this is a priority. I mean, this is somebody who's seriously, desperately ill, you know, crushed, smashed up, literally on the verge of death. You would think that all hospitals, it would be a priority, they'd be geared up for it. You, who are one of the most eminent people in this field, say in actual fact that trauma is the Cinderella of the health services. How and why is that?
It's very difficult to be absolutely sure, but trauma is very unsociable. It's unfashionable. You're up at night, weekends, and people don't want to subspecialise in trauma. There are other subspecialties that are more attractive. Plus the fact that you're dealing with very difficult problems. They're not for the faint-hearted. They are problems that you have to have a lot of training. You have to have a big team around you that are understand what you're doing. We have that in Tallaght. We have a phenomenal team in Tallaght treating these injuries. Since I started in 1985, when I came back from Toronto, to Dr. Stevens, I've done personally over 1,800 of these major injuries. I set up the unit in Dr. Stevens, then we went to the Meath, and then we went to Tallaght. And it is a national centre where all of the major trauma patients come from all over the country to Tallaght. And that is one of the strengths of Tallaght, because it deals with all of these patients. These are the most horrendous injuries you will see, and we take about 120 of these per year from all over the country. So it's a huge problem. You can't come along and just say do 5 a year, because you won't have your skill mix up. You have to do in relation to these injuries, you have to do between 20 and 30 per year to keep your skill mix up. They're all different and individual. The biggest problem with a lot of these is interpreting what type of fracture it is. How do you approach it operatively? They're very, very difficult.
And it is vital that when you see, I mean, for example, in Orla's case, when Orla had her accident, whoever was on the scene, first of all, and was looking at her and diagnosing her, she was, if you'll pardon me saying this, her lower half was in such a mess, it would be hard to know where to start. And this is a part of the problem that you find that they don't know how to prioritise. And if they don't prioritise properly, then the eventual outcome isn't what it should be, or as good as it should be.
True, but there are protocols in place. A lot of institutions have protocol on the initial assessment and the initial management of all patients with multiple trauma. And that was set up in terms of, in Orla's case. But they're not geared for this very specialised work, and you can't expect them to be geared for the specialised work. You can't.
This is basically war zone medicine, isn't it?
This is tough. Yeah, exactly. Yeah, this is.
And I was surprised when you said that it wasn't that it was unsocial. I would have thought that for somebody who has the vocation, who has the Hippocratic vocation, that this would be the kind of stuff that they would gravitate to. This is cutting edge stuff. This is saving. This is life or death stuff.
That's correct. Yeah.
But
there are a lot of other subspecialties in trauma and orthopaedic surgery, like joint replacement, like sports medicine, like spinal surgery, like foot and ankle. They're all less demanding. And you have to also remember that it's not everybody's cup of tea to be doing major trauma. They just may not be able to
by definition, it's messy, isn't it?
Well, it's not messy, it's difficult. But it's not for the faint-hearted.
We have some graphics of some of the sort of stuff that you will do. Oh, by the way, I think, Orla, this is yours, is it?
That's right.
So, well, I mean, I think you can immediately see there's very large pins. I can see effectively a ring of metal on one side, and I can see more above the pins.
Yeah.
So, is Orla essentially a bionic woman at this stage?
Very much so, very much so. Pat Kiley, my colleague, reattached her spine to her pelvis, and I did the rest.
So, I mean, well, how do you learn how to do something like this? I mean, obviously you're a surgeon.
Yeah.
But I mean, that is coming out with a basic surgery degree, even you do an internship in a couple of years and all the rest of it. I mean, you're still light years away from being able to do something like that.
Absolutely. Basically, I trained as an orthopaedic surgeon here in this country, and I got a very good training, because it is one of the best training programs, and the Irish Institute of Orthopaedic Surgery have held up a very high standard of training. And then you go overseas, and in my case I went to Toronto. I went to a level 1 trauma centre. I worked with a guy called Marvin Tile, who is an international figure in pelvic and acetabular fractures. And I started to learn the trade from there. And then I came back and I started to work on them here. And I've taught a good few young people how to do it, but unfortunately, there aren't that many people.
This brings us, I know, because time is against us, so I want to get to the point here, and it is your major point, is that you want a dedicated centre here. Yeah. You want all of the skills that you have acquired, that you've learned from other masters, so to speak, and you want to be able to pass them on in a very structured way. Yeah. And there isn't a facility here for you to do that the way you would like.
Well, we have Tala. Tala is the major centre for...
But you want more. What?
I want more. Basically, I would like to see 4 level 1 trauma centres in this country. I'd like to see our trauma service being upgraded. We do not have a system of care for the multiply injured or the polytrauma patient from the scene of the accident through to the hospital service, out the other end, rehabilitation, back to work. There are many links in the chain. There are many links missing, or else if they're not missing, they're not joined up. We need a proper, comprehensive, coordinated trauma centre, a trauma service in this country. We need 2 level 1 trauma centres in Dublin, one on the north side, one on the south side, one in Galway, one in Cork. And trauma has to be given a priority, because if trauma is treated badly, then it's going to cost the exchequer an awful lot of money in terms of the patient having major complications. That is very expensive.
Well, you are the most senior man, the most eminent man in your field. You've called for it. Whether or not it'll fall on deaf ears, I mean, when they're, we've only barely got them to stop taking medical cards off people who actually need them. So we wish you well, and sure, maybe we'll get a chance to highlight it again. Orla, congratulations on your progress, because it is quite, folks, I wish we had a camera to watch Orla coming in, because you would see just how badly she's been injured, and just what kind of progress she's made in 15 weeks, which is extraordinary, I think. Good luck. Now, after the break, we're going to meet some ladies who are involved in this year's mini marathon.